Mark, the holidays obviously include a lot of travel and sometimes hours spent flying from coast to coast. Those long periods spent sitting in one location can put you at risk for deep vein thrombosis. For the causes, the risks, and treatments for this very serious condition, we welcome Dr. Pineda, a vascular surgeon at the Polyclinic. Thanks for being here. We call this DVT, right? We hear it referenced that way on television and in commercials. What is it? What happens?
Right. So DVT stands for deep vein thrombosis. And basically what happens, you form blood clots in the deep veins of the calf, the thigh, or the pelvis. And these are particularly dangerous because if they break off, they can travel through the bloodstream, go into the heart, and go into the lung, causing what's called a pulmonary embolus.
Which results in?
Well, it can be lethal, so it can actually be deadly.
Wow. Is there any way to know you're developing one?
Well, there are certain risk factors. You mentioned air travel, and that's certainly one of the more common risk factors. So any sort of immobility. So for example, long flight, long car trip, but also people that are in the hospital after major surgery.
Right.
They're not
they
really
can't
moving
move around.
Exactly. They're not really moving around very much. They're immobile, so the blood doesn't flow as swiftly. So what some of the symptoms you can get are swelling in an extremity along with pain. And sometimes you can get some discoloration in the leg and tenderness.
Almost everybody's feet and legs swell on flights, right? That's a pretty common thing. How do you distinguish when that's serious from when it's not?
I would say if there's also pain. If you're noticing pain, not just swelling, especially if it's only happening in one leg. DVTs can happen in both legs, but that's less common. It usually only happens in one side.
Likely it's just one. What period of time are we talking about? Can it be 2 or 3 hours? Does it take more than that?
Right, so it's usually around 4 hours.
Around 4 hours. So if you notice this on a flight, and let's say you're flying to Europe and now you're not even halfway there,
right.
What do you do?
Well, I think one of the things you can start by doing is, let's talk about prevention.
Okay.
You know, you want to try to prevent this from happening in the first place. So one thing that's important if you're going to be on a long flight is to avoid caffeine, avoid alcohol, because these tend to dehydrate you.
Okay, you've just ruined my flight.
Well, one thing you can do though is you can have your glass of wine, but then have some water after that.
Okay, make sure you stay hydrated.
Make sure you stay hydrated. Another byproduct of staying very hydrated is that you'll probably need to go to the bathroom.
So you'll get up and move around.
So you're going to get up and move around. Now, if you're sitting in the back and there's not a lot of room to move around, then you can start doing some exercises while you're sitting in the plane.
Okay.
You can do ankle pumps, you can move your feet around, you can lift your knees, and all of these things are trying to basically replicate what your body normally does when you're walking.
To push the blood around and to keep it moving. Okay, so we're just talking about moving your feet up and down, moving it around, pumping your knees up and down, which you barely have room to do, but you can do. And I've even noticed they have instructions for some of those exercises on long-haul flights occasionally in the
they do.
Seat back information that they put there for you. How often should you do those if you're on a long flight?
So if you're on a long flight, you want to do these exercises at least twice in an hour, and then every 2 hours try to get up and walk around.
Okay. Do compression socks or hosiery help?
They absolutely do. In fact, there was a recent meta-analysis. A meta-analysis is basically a study where you take all these different studies and then combine them and use some mathematical wizardry. And basically, they showed that wearing compression stockings does decrease the risk of developing a DVT during long flights. So every time I see a patient in the office, if they have any long travel coming up, I always recommend getting compression socks.
For men or women. And there are actually some nice looking compression socks out there now. You don't have to look like you just, got out of the hospital 10 minutes ago if you don't want to. So if a DVT is not diagnosed, if it's not treated, what happens and how do you treat it?
Right. So, as I was mentioning before, the DVT is a blood clot that forms in the vein.
Right.
And as the blood clot is not treated, it gets bigger. And it starts traveling up closer to where the heart is. Now, the biggest fear is that one of these clots will break off and
It
travel.
might not, but it might.
Not, but it might. And the degree of risk has to do with where the blood clot is.
Okay.
So if your blood clot is in the calf, it's less likely to break off and go to your lungs. But if it's in the thigh, it's more likely, and if it's in the pelvis, it's much more likely. So that's the risk if you don't treat it. The way we treat it, again, kind of depends on where it is.
Okay.
So the closer it is to the heart, the more dangerous it is. The mainstay of treatment is using blood thinners. Now, the blood thinners, they don't really dissolve the clot. They actually prevent the clot from getting any bigger. So that's what keeps us safe. Your own body, over time, will actually dissolve the clot on its own or form new veins around where the blood clot is.
Interesting.
To go around the area that got blocked. And that's why it's important to treat that. Now, unfortunately, the only way to really diagnose it is not really just with a physical exam or history. It's combining those two and also doing an ultrasound. An ultrasound is a quick, non-invasive test. They basically pass the probe up and down your leg, checking to see if the vessel can be compressed or squished, and that's how we diagnose.
Interesting. So if you got off of a flight or you felt like something like this was happening to you, would you go to the emergency room straight away?
Correct.
Okay. And is this different in any way from varicose veins, other kinds of venous problems that we might have? Are we more at risk if we have those? How should we think about that?
Right. So I'm glad you asked that. So venous problems in the legs are extremely common. And when people have varicose veins in and of themselves are not really a direct risk factor for forming a deep vein clot, but they do put you at risk of forming superficial blood clots because now you have all these extra veins that should never be there in the first place. And if you get sort of into that perfect storm scenario, immobility, long flight, dehydration, you can form blood clots in these superficial veins. Now, those are managed differently because now we're talking about surface veins. They're not as dangerous as the deep veins, but depending again on how big the clot is, how close it is to being to the deep vein, then we would manage some of those with blood thinners. So it's always a good idea to get those checked.
Wow. Okay. Well, it's a good reminder, and we'll make sure we get moving on airplanes and car rides.
There you go.
Don't even risk it. For more on vascular surgery and other ways a polyclinic can meet your health needs, please visit their website, polyclinic.com.